Most people think high blood pressure becomes dangerous at numbers like 140/90. That's the kind of blood pressure that clinicians look at to potentially start you on treatment. But cardiovascular risk doesn't just suddenly appear at 140 systolic blood pressure. In fact, it happens years earlier, and a lot of people don't even know this. With numbers that clinicians describe as slightly elevated, numbers like 135/80, this is exactly the stage where prevention matters. Most clinical guidelines roughly classify blood pressure like this. Blood pressures around 130s isn't considered as hypertension, and many clinicians will reassure patients medication wouldn't be required, and that reassurance is completely appropriate. Where prevention medicine differs is how this stage is interpreted. You see, cardiovascular risk increases gradually over time. If every person with high to normal blood pressure reading received medication, this would lead to over-medicalization. So guidelines focus on treatment thresholds, not optimal physiology. And that is a really important distinction. Large population studies have shown the risk of stroke and heart disease begin to arise progressively around 115 systolic and upwards. And this is really important, even for us clinicians, because I'm sure when I'm in clinic, my blood pressure is not 115 and below. So two things can be true at the same time. Your blood pressure may not require medication yet, but it's not ideal for long-term vascular health. So what's going on then? Well, blood pressure that sits in the 130s consistently. The arteries are exposed to slightly higher pressure thousands of times every day, every heartbeat. And over the years, that pressure contributes to gradual changes in the cardiovascular system. Arteries can become stiffer, heart muscles can thicken, and the long-term risk of stroke and heart disease can progressively or slowly begin to rise. But this is a very slow process. It takes time and decades for this to occur. However, this is exactly why prevention health really matters early. Borderline blood pressure is where lifestyle changes matters most. For example, and in no particular order, regular exercise, maintaining a healthy weight, reducing stress, limiting alcohol, and improving sleep. Combined, these changes can significantly delay or prevent the progression to hypertension. It has the greatest impact, and that's because structural changes haven't progressed yet or not happened at all. In fact, it's the small changes that can really shift blood pressure by quite a few points. So when we see numbers like 130/80, it doesn't mean panic. It does mean pay attention. We need to act before cardiovascular risk becomes a topic of conversation. We need prevention to start early, well before symptoms occur. So borderline blood pressure is not a diagnosis. It's an early signal that our cardiovascular system is under strain. And the quicker we act on that signal, the better and more powerful prevention becomes. Thank you so much for watching, guys, and I'll see you in the next video.